Sex is the life force energy that runs through us all. Can you use sexual energy for your spiritual evolution? Or perhaps for emotional healing? Is it even possible? Clinical sexologist Dr. Martha Tar Lee will explore all these and more on Eros Evolution on Om Times Radio.
Hello, and welcome to Eros Evolution. This is where sexuality and spirituality meets. My name is Martha. I'm a clinical sexologist in Singapore, and I am from Eros Coaching. That's Eros coaching.com. And this week has been very eventful for me. I had two guests come in from Bali, and they're doing the visa run. And what happens is you can only stay in Bali for X amount of time. And so they flew through Singapore and going to fly back there. The first person that I met was Damaraj, and we hung out for a day. And James Stevenson is coming into Singapore on Saturday to run a tantric puja. And so it's exciting that I'm starting to get new friends passing through Singapore. And I'm also next week going to be Penang in Malaysia, and I'll be there from the 15th to the 22nd running two workshops. And I'll be in Kuala Lumpur in April, and also Bali as well in April. So if you're interested to find out more about my events, go to eroscoaching.com/events. And in today's show, we're going to be talking about STI surprises, unusual causes for a common bladder infection on the rise in women and men. And we have Sherry Torkos. She is a pharmacist, author, certified fitness instructor, and health enthusiast who enjoys sharing her passion with others. She graduated with honors from the Philadelphia College of Pharmacy and Science in 1992. Since then, she's been practicing holistic pharmacy in Toronto, Ontario. And her philosophy of practice is to integrate conventional and complementary therapies to optimize health and prevent disease. She's won several national pharmacy awards for providing excellence in patient care. As a leading health expert, she has delivered hundreds of lectures to medical professionals and the public. She's been frequently interviewed on news channels throughout North America and abroad. She's authored 18 books and booklets, including Saving Women's Hearts, the Canadian Encyclopedia of Natural Medicine. So let's welcome Sherry. Hi, Sherry.
Hi there, Dr. Martha. How are you?
I'm good. Thanks for coming on for today. And I have been looking at what your brief sheet is talking about, the STI surprises, and I would say that there's no irony that I am having an STI right now, a UTI right now.
Yeah, a UTI. Oh boy, yeah. They are incredibly common infections. We're looking at the second most common infection that women get are urinary tract infections, also called bladder infections or cystitis. So very common, very uncomfortable because it can lead to those symptoms of frequency and urgency and burning and pain when you're urinating. But thankfully, there are a lot of things that we can do to prevent them.
So let's go right into it. What are some of the things that we can do to prevent a UTI?
Well, first I think important to understand that urinary tract infections, they're more common in women because of the anatomy of a woman and the fact that the urethra is closer to the rectal area. And anytime bacteria can get into the urethra and travel into the bladder, it can cause an infection. So, of course, when we're talking prevention, one of the most important things that I can encourage women to do is to avoid to urinate before and after intercourse, to make sure they're flushing any bacteria out of that area. Also to wipe from front to back. And most girls are taught that when they're young. When you're going to the toilet, you don't want to take the toilet paper and wipe it from your rectal area into the vagina because, of course, that can bring bacteria into that area and into the urethra. So you want to wipe from front to back. Drink lots of water. That's important so that you can keep bacteria, again, flushing through your system, hopefully not get dehydrated, because if you get dehydrated, that can increase the likelihood of getting a bladder infection. So these are some of the lifestyle type things that can help. And then from a supplement perspective, there are certain supplements that can help protect against bladder infections. Probably the most well-known and researched is cranberry. And cranberry has, it's been studied for decades and found to offer bladder benefits, but not just any cranberry. You don't want to just have cranberry juice or a juice cocktail. There's an ingredient that you need to look for in supplements. It's called Cran Max, and that Cran Max ingredient has been backed by, almost a dozen clinical trials showing that if you take it regularly, it can help protect you against getting bladder infections. Yeah, it works by, it's interesting because the Cran Max, the cranberry, works by preventing bacteria, actually changes the structure of the bacteria so that it's less likely to cause an infection. So it has a very unique mechanism, unlike antibiotics, which kill bacteria and, of course, lead to the risk of resistance and other side effects. The Cran Max, the cranberry, it just changes that structure of the bacteria, whether it's the E. coli or Salmonella or other bacteria, so it can't stick to the bladder wall, can't cause infection, and then it just, flushes out of your system. So, as a pharmacist, this is something that I highly recommend.
That's great. So that's cranberry max, you said.
Yeah, it's Cran Max. It's CRANMAX, Cran Max. And what it does, again, you take it on a daily basis as a preventative because, the reality is nobody wants a bladder infection. They're painful, they're uncomfortable, and if you get a bladder infection, often you have to take an antibiotic to treat it, whereas if you are proactive, you can, make sure that you're staying, again, hydrated, proper hygiene techniques. And if you're a woman listening and you tend to get these frequent bladder infections, important, to consider taking the Cran Max as a preventative.
Okay, so when I went online, and because I actually do have this pretty regularly, and I went online and I looked at there's some products that I can take, including like biofilm and Manos. Do you know this Manos powder?
Manos,
so do you feel that they will work, or like Cran Max is the only thing that I need?
Well, there are some companies that will combine cranberry with D-Manos, but the evidence on the D-Manos isn't as strong or as convincing as the evidence, the clinical studies that have been done on the Cran Max. So I guess top of my recommendation would be the Cran Max, also probiotics to keep levels of friendly bacteria optimized. I think that is also very important. But again, you can take D-Manos along with the Cran Max. That can be helpful as well.
Okay, that's great to know. And one of the things that did surprise me in the brief that came in is that men also suffer from UTI. I've actually not known or met any men who actually said they have ever had a UTI. Could you elaborate more about how men and how many men are affected by UTIs?
Yeah, for sure. We do tend to think of this as a female problem. However, men tend to get more risk of bladder infections with advanced age. As a man ages and the prostate gland enlarges, the prostate gland, it surrounds the urethra. The urethra is that tube that carries the urine out of the body. So once if you can just visualize the urethra as almost like a hose, and if you surround that hose by, say, a balloon and put pressure on that hose, it's going to prevent it from emptying and draining. And that's exactly what happens with the prostate. As it enlarges, puts pressure on the bladder and the urethra, prevents complete emptying, and that can increase the risk of the urine stagnating and developing bacteria. So for men, we tend to see bladder infections more commonly with advanced age. As men get into their 50s, 60s, and 70s, becomes more common. And the Cranmax is something that men can take as well. Also important to be proactive when it comes to prostate enlargement, because there are certain supplements like saw palmetto and pygeum and other natural things that can help to prevent prostate enlargement. And these are beneficial supplements for men to consider.
Okay, that's great to know. So we're talking about UTI Surprises with Sherry Torkos, and we are exploring why men and women have UTI, that's urinary tract infection, not to be confused with what I often talk about, STI, sexually transmitted infection. No, we're talking about something completely different, and there is no irony that right now, currently, I am having a UTI, and I've been battling it for the last week, taking probiotics, taking D-mannose, and I just realized that I could also explore taking Cranmax, and we're going to have a break coming up very shortly, and very effective, so I'm definitely going to look into it. So we have a break. Do be sure to check out Sherry's website, that's Sherry Torkos, TORKOS.com.
Your conscious lifestyle on steroids. Om Times Radio. IOM FM. Host your show on IOM FM, the radio network of Om Times Media, one of the more recognized brand names in the conscious community, and is backed by the extensive marketing reach of Om Times. Hosting a show on IOM FM immediately connects you with our extensive dedicated community.
Hi, I'm Kelly Fox, host and astrologer of The Astrology Show. Each week, I'll give you access to the current transits, which are a valuable tool that provide astrological information to help unlock the potential each of us has. Understanding the stars can help steer us in the right direction to make better informed choices. So if you're wondering what's going to happen in your week ahead, be sure to tune in to The Astrology Show for guidance. Mondays at 9 p.m. Eastern Time.
Every 2 minutes, an American is sexually assaulted. The majority of victims know their attacker. It could be your friend, your neighbor, or someone you met at a party. If you said no, it's rape, and it's a crime. This is Christina Ricci with RAIN. Call the National Sexual Assault Hotline today at 1-800-656-HOPE or visit RAIN.org. That's RAINN.org.
Brought to you by RAIN and this station.
You are listening to Eros Evolution on the Om Times Radio Network, and you can share this show with your friends right now by going to the link omtimes.com/mobile. With this link, you will be able to listen to the show without needing to download any app. Today, we're talking about UTI surprises, and we're going to delve into the 3 surprises, or maybe more, of causes of common bladder infection for men and women, and we're with Sherry Torkos, and you can find her at sherrytorkos.com. So tell us, what are the UTI surprises?
Well, I think one of the most shocking for people to hear about is the fact that there is a growing body of evidence that suggests that women and men as well are contracting bladder infections from consuming or being in contact with contaminated chicken. And it can happen very easily. We know that raw chicken can contain bacteria like E. coli, and if you are touching that chicken, if you're preparing it, and perhaps you don't wash your hands thoroughly, then you go to the bathroom, as you're wiping yourself, maybe a little bit of that residue under your nails or on your fingertips touches in the genital area. You can see how it would be easy to contract and transmit that bacteria directly from your hands to your body. But here's the other shocker. Even if you are consuming contaminated chicken that's been treated with antibiotics and that has antibiotic resistance, that can also be associated with development of bladder infection.
Okay. So chicken. So
Yep,
I'm vegetarian. I'm vegetarian, so I don't think I have this thing happening in my body. And what are some ways you can prevent that if you do eat chicken?
Well, the most important thing
making
is
sure your hands are.
Yeah,
Sorry, go ahead.
To cut your chances, I would say it's important to, first of all, choose meat that is hormone antibiotic free, so natural meat. Make sure that you cook it thoroughly. And when you're handling meat, make sure that you wash your hands very, very good, soap and water and under the nails. That's just, good practices to reduce the likelihood, again, of having any possible bacteria on your hands from getting into your body. I also suggest keeping a separate cutting board to be used for handling raw meat or poultry. And when you're finished using it, you want to make sure you clean it thoroughly. Hot, soapy water is really the best.
Yeah, that's very, very practical and great suggestions. Anything else?
Yeah, I think there's two other, shockers when it comes to bladder infections. Because, when we're talking bladder infections, most people will think, well, this is something that just affects older women. Not the case. As you indicated, Dr. Martha, you have one right now, and you're a young woman. This can happen in younger women. Some women are just predisposed. It can happen, though, due to hormone changes. Stress can bring it on. As I just mentioned, a surprising risk factor could be exposure to meat that has bacteria. Also, there are two other surprises that a lot of people may not have heard about, and that is that people that have spinal cord injuries or are using catheters, they are at greater risk of getting bladder infections, and that's due to two reasons. There's less innervation to the pelvic area. Of course, the in and out of the catheter introduces bacteria, so that can be a culprit. And lastly, medications. There are certain medications that people may be prescribed that can affect their ability to void and urinate completely. And when we are not urinating completely, that can, of course, lead to the risk of bacterial growth and infection. So you really have to check with your pharmacist when you're getting prescriptions, because some of the allergy medications, antihistamines, things like that, they can cause urinary retention.
What can they do about it?
Well, when it comes to preventing the medications, I would suggest asking your pharmacist if you are at risk of getting bladder infections, if any of the medications you take could be triggering or causing problems, and ask maybe to the pharmacist to recommend an alternative. Also think about, instead of using antihistamines or some of these drugs, look for some natural remedies that don't have those side effects. When it comes to antihistamines, there are some things you will find in a health food store that can provide some benefits without the risk of the side effects.
Yeah, that's good to know. That's really good practical advice. There are more natural alternatives if you have any reasons why you need medication, for instance, like a cold, flu, allergy. I know antihistamines are actually very often prescribed. So you mentioned like natural remedies. Could you give some suggestions of what they might be?
Yeah, for allergies, there is a natural antihistamine called Butterbur. It's Butterbur. It's great for its antihistaminic properties. so you can check out Butterbur. It would be something that you would find in a health food store. Probiotics are also helpful. The idea of replacing, your body with friendly bacteria to help reduce the likeliness of having some of these reactions. So consider probiotics. Also quercetin. It's an antioxidant. Quercetin can be very helpful. Vitamin C as well.
That's wonderful to know. Great. Yeah, there are natural ways to prevent UTI. So let me come backtrack a little bit and ask, there are a lot of studies that show that we should just stop taking meat. I'm vegetarian. So, you are a pharmacist, and you feel that besides the issue of possible UTI and the suggestions you mentioned, which is proper meat treatment and taking organic meats, would you recommend for our health that we should just stop taking any poultry?
Well, I would say this. Some people do better on a vegetarian diet, and they feel better. They have more energy, less digestive problems. I guess, what I would suggest is if you are going vegetarian, you just need to make sure you're getting adequate protein and all your amino acids and nutrients through vegetable sources and beans and legumes and things like that. If you are consuming meat, poultry, I would recommend going with hormone antibiotic-free, also free-range. For a lot of reasons, I think those are better choices. It's becoming more affordable as well. Years ago, it used to be very expensive to eat organic, hormone-free food. Now there's greater availability. The prices have gone down, so it is something that is, more achievable.
That's all very great advice. Thank you. So, we also talked about how this poultry is injected with hormones, and then we talked about how with hormones and with antibiotics, and we also talked about how medication, all these antibiotics that we're taking to treat cold, flus, and allergies is now resulting in people having more antibiotic resistance. So how can we protect ourselves more from that?
Yeah, well, what I would suggest is it is important to be proactive. Antibiotic resistance is a real concern, and although I'm a pharmacist, I don't believe in taking antibiotics unnecessarily. So if you have a cold or a viral infection, before you ask the doctor for antibiotics, it's important to know whether you have a viral or bacterial infection, and keep in mind that antibiotics are only effective for bacterial infections, not for viruses. I talk to patients all the time in the pharmacy about this because people will, feel that they've got a cold, they want an antibiotic to make them feel better, but we have to have this discussion that the fact is that if you have a virus, whether it's a cold or a flu, an antibiotic is not going to do anything for you, but it could lead to resistance. Here's the problem. If you take antibiotics regularly over time, the bacteria, they get smarter, they morph and change, and they become resistant to the effects of the antibiotics. So it becomes a bit of a public health crisis. And we're seeing this across North America where the bugs, the bacteria are getting stronger than the drugs. They're getting smarter and stronger, and they're changing to adapt. So only take antibiotics if you absolutely have to. Try to be proactive and preventative. So whether we're talking about using products like Cranmax, the cranberry for preventing UTIs, or if you're looking at supporting your immune system to cut the risk of cold and flu, think about echinacea, vitamin C, and elderberry, and some of these other things to keep your defenses strong so that you can hopefully avoid needing antibiotics.
That's great advice. So we talked about antibiotics and we talked about antihistamine. What are some other medications that might cause UTIs?
Well, the main medications that could affect urinary flow are the antihistamines. Those are, again, medications that people take not only for allergies, but some people have skin rash, itchy red skin, and they may take antihistamines for that. Sometimes people take actually antihistamines to sleep. There are certain drugs that are marketed for sleep as sleep aids, and some of them contain antihistamines, and so as a side effect, you can get that urinary retention.
Okay. And so I have a curious question. Maybe it's really more from ignorance. If you have taken a lot of these things, antihistamines, do they stay in your body, and will they actually, on the longer term, result in you becoming more susceptible to UTIs?
No, the antihistamines, they don't have a cumulative effect in your system, and that's a good question to ask. It is reversible. So if you take antihistamines occasionally for allergies, they might stay in your system for 24, 48 hours, but that would be about as long as they would last. It's not a long-standing effect.
Okay, that's good to know. Okay, so what about those people who just understand all these things but feel that they have no choice and they have to use these medications? What can we do to counteract the side effects?
Well, what I would suggest when you're taking an antibiotic, a couple of things. Take the full course of the antibiotic. In other words, don't take it just for a few days, stop taking it, and then keep it on hand for use at a later date, because repeatedly taking antibiotics can lead to resistance. So only take it when you have to. Take the full course of medication, and try to use the more simple medication before you get into the broad-spectrum antibiotics. So, for example, if you have a dental infection or you have, say, a sinus infection, your doctor may prescribe something simple that's been around for a long time, like penicillin or amoxicillin. If you get prescribed that and it works, great. Try not to ask your doctor, unless it's warranted, for the broad-spectrum antibiotics, because the antibiotics that have been developed in more recent years, they're considered broad-spectrum, meaning they work against lots of different types of the bacteria, and using those types of antibiotics does have greater likelihood of causing resistance.
I see. Okay, so we have a break now, and when we come back, we can delve more into this question. So we're with Sherry Torkos, and you can find her at sherrytorkos.com.
Free your mind with Om Times Radio, IOM FM. Om Times Magazine is one of the leading online content providers of positivity, wellness, and personal empowerment. A philanthropic organization, their net proceeds are funneled to support worldwide charity initiatives via Humanity Healing International. Through their commitment to creating community and providing conscious content, they aspire to uplift humanity on a global scale. Om Times, co-creating a more conscious lifestyle.
Hi, this is Julie Geigel.
And I'm Susan Schuler.
And I'm Lori Walker.
And we are
the Psychic Angel Channelers
from Angel Talk Tuesday.
Tune in every week at 10 a.m. Eastern on OmTimesRadio.com.
The angels have heard your call and are here to help.
Are you ready to receive?
Bathe in the beautiful vibrational frequency to help you heal, expand, and remember your magnificence with Angel Talk Tuesday.
What's up? This is Brad
and Mike from Lincoln Park
for Life Beat, the music industry fights AIDS.
Listen up, times are tough and you get a lot of things thrown your way. If you're being pressured to have sex and you're not ready, then say no. If you're having sex, be smart and use protection. Respect yourself and protect yourself.
For more information, call the National AIDS Hotline at 1-800-342-AIDS or log on to www.lifebeat.org.
Welcome back to Eros Evolution. This is where sexuality and spirituality meet. We're talking about UTI surprises today, and so far on today's show, we've talked about what is UTI, whether it is a female problem only, what are some surprising causes of UTI, whether we should just stop eating poultry, and how we can protect ourselves from antibiotics resistance. We also talked about the remedies that can be taken, like cranberry and creme max that Sherry is recommending, and we also talked about side effects of medications and what medications cause UTIs. So yes, we've talked about many things today, and I'm with Sherry Torkos. She is a leading pharmacist, author, certified fitness instructor, and health enthusiast, and she has a lot of credentials behind her. She has delivered hundreds of lectures to medical professionals and the public. She's been frequently interviewed on the news shows throughout North America and abroad. And she's authored 18 books and booklets, including Saving Women's Hearts, the Canadian Encyclopedia of Natural Medicine. So be sure to check out her work because she's amazing. And her website is Sherry Torkos, that's TORKOS.com. So just before the break, Sherry, you were answering some question around counteracting the side effects of medications. Is there anything else that you want to add or elaborate on that?
Yeah, I guess I would add that as a pharmacist, I think it's important to can take a probiotic before, during, and after antibiotics. The probiotics are the beneficial bacteria. They replenish what is killed by the antibiotic, because antibiotics, they don't just kill the bad bacteria, they kill the good stuff as well. So I would recommend taking it before, during, and after, and also to separate the dose. So don't take your probiotic and your antibiotic at the exact same time. Try to separate it by a couple of hours.
Okay, what is the reason that we want to separate them from a few hours?
Because the antibiotics could kill the probiotics. So you want to try and take them at a separate time. And also, too, remember when you're taking antibiotics, there are certain foods that some of them you have to avoid taking with certain foods. For example, grapefruit juice can interact with some antibiotics. Same with dairy products, things that are high in calcium can interact as well.
Oh, that's all very, very useful and important to know. My goodness. It sounds so simple and common sense, but really is not. It's the uncommon common sense because we don't know what we don't know. And we're taking medications and we are reducing the effects of it. And so that's definitely not good. Yes, for many, many years, I didn't know about probiotics at all, and it seems that all bacteria is bad, and to even understand that there's such a thing as good bacteria was really life-changing for me. I had chronic fatigue. Yeah, go on.
Oh, I was just going to say, a lot of people think all bacteria are bad, but definitely not the case. So you were saying you had chronic fatigue. Was it this is something you've had for a while?
Yeah, because I used to take a lot of antibiotics. I would fall sick, and I would just keep, taking them. And I was just tired all the time, and I didn't know that I was gluten intolerant. And I'm now taking probiotics every day, actually, to help me with my digestive system. And didn't know that I needed probiotics if I take antibiotics. So this has really affected, I feel, my entire system, and made me very susceptible to UTIs, and just not very good for my body. You don't know what you don't have until you start feeling really healthy, and then you realize, oh my God, how could I have survived all this time without knowing that I needed probiotics?
Mm-hmm. Definitely. I would say, there are a lot of folks that have probably been in similar situation where repeated courses of antibiotics. I mean, women take antibiotics often for bladder infections, for sinus infections, Sometimes even young girls end up taking a lot of antibiotics because they get ear infections, and repeated courses of antibiotics can really do a number on your microflora in your gut, wiping out and destroying that beneficial bacteria. So it's something really important to replenish and restore and rebalance.
That is so important. And just as we were speaking, I actually had a colleague send in an email and asking about where is that email? Asking about this lady, this client she had that had gone through a lot of tests and now been diagnosed to have a yeast infection. So what can she do about it?
So she has yeast infections. There again, probiotics are very, very beneficial for fighting yeast infections, and there's lots of different types of probiotics. So when we say probiotics for as a category, there's dozens of different types. Yeah, there's lactobacillus and bifidobacterium and others. So what I would suggest is looking for something that has been studied specifically to help with providing beneficial bacteria in the vaginal area, such as the lactobacillus bacteria. When we look at the research, the lactobacillus in particular, I think it's Lactobacillus reuteri is one of them that has been specifically studied for vaginal yeast. And I'm just looking, there's a product in particular that has been used and that is available. Primarily you can get this one in pharmacies. I believe it's called R.Ph. It's R.Ph. And it's a R.Ph resh. So it's R.E.P.H. R.E.S.H. And in other words, it's refresh, only using the pH for the spelling. And it's a specific probiotic that has been studied for vaginal health. So that's one that I would consider. Also, some women find that making dietary changes is helpful, so cutting out sugar and gluten and yeast from the diet, that can be helpful. Taking oil of oregano in drops orally, diluted, and also taking garlic, in particular aged garlic extract, that can be helpful as well.
Great. Great to know all these tips here and there. So as a pharmacist, we're talking today about UTIs and the surprises and what we can be doing with regards to medication. So can I ask a little bit about what we can take in order to boost our immune system and also boost our sex drive?
Yeah, so when it comes to immune system, let's start there. There's a lot of things that can help with immune system support, vitamin C, vitamin D, echinacea. There are different types of mushroom extracts as well, such as AHCC, which is a specific type of mushroom extract. There's also, again, getting back to the probiotics, that would be beneficial. So think about some of those strategies, making sure you get enough sleep at night. That's very helpful as well. So for boosting immune system, those are some ideas. Now when it comes to sex drive and libido, there are a lot of things, as I'm sure you've talked about in your show many times. So many things affect libido, from stress to hormone levels to alcohol, diet, just the relationship. But just in general, I can say that there are some things that can help both men and women, considering if there's no underlying cause of low libido, for example, no medical cause, maybe it's just, a lack of adequate testosterone, but aside from that there's no other underlying cause. There are things you can check out, such as Tomcat LE. It's also known as Uricoma longifolia. Are you familiar with that one?
Yeah, we have that here. It's popular.
Yeah, Tongkat Ali is, it's big in Malaysia. A lot of the research has been done in Malaysia. There's one in particular called Physta, Physta, that's been shown to raise testosterone and DHEA levels to normal, and that this can also help lower cortisol levels, the stress hormones. So that's one to consider. There's been some evidence to show it can improve sexual performance and satisfaction, boost energy levels as well. So that's one to consider. Arginine as well. Arginine, which is an amino acid that is involved in the production of a compound called nitrous oxide, which is a vasodilator. There's been some studies to show it can improve sexual desire and function in both men and women. You'll often see it combined with other things like ginkgo or ginseng or damiana. So think about arginine, ginkgo biloba. Also, there's something called muropoma, which is also known as potency wood. And there's been studies showing that it can improve libido and other aspects of sexual function in both men and women. So those would be a couple of things to look at.
Okay, I know about maca. How about maca?
Yeah, maca as well. Maca has been found to offer benefits for libido. Sometimes you see it on its own. Sometimes it's combined with other things. So that would be another one to take a look at.
So indulge in me. What's the difference you feel or the benefits if you compare Tongkat Ali and maca?
Well, Tongkat Ali, I guess if we look at mechanism of action and research level, I guess I would say Tongkat Ali or Uricoma longifoli would be more top of my list. It seems to me when it came to maca, there were some side effects that I had read about. I'm not sure if they were based on animal studies. Just looking it up as we're talking here. But it seems to me there were some uterine-type side effects that can occur with maca that, are concerned for some people. And I would say that the research on maca is more in the preliminary stage.
I see. So sorry to clarify. What are the side effects?
So when it comes to maca side effects, well, we can, I guess, chat about it when we get back from break, and then I'll recap.
Yeah. Great, thanks. So check out Sherry.
Bringing you the best of the conscious minds in the world. Om Times Radio, your conscious lifestyle on steroids. The number one reason girls drop out of school in sub-Saharan Africa is lack of access to feminine hygiene products. The Pads for Schoolgirls Project, an outreach of Humanity Healing International, is changing this paradigm by setting up sewing programs at schools, teaching girls a vocational skill, while producing the reusable pads that help keep them attending classes. The girls pay it forward by making and giving pad kits to other girls in need. To learn more, visit humanityhealing.org. Humanity Healing is where your heart is.
Join me, Tammy Adams, intuitive life coach and spiritual healer, for my new show, Karma Talk. Learn how to get rid of your karma so that you can start living the life you are meant to live. I am not going to tell you what you want to hear, but what you need to hear. Join me on Wednesday at 12 p.m. Eastern Time for Karma Talk on Om Time Radio.
It's on us to stop sexual assault.
To get in the way before it happens.
To get a friend home safe.
And to not blame the victim.
It's on us.
To look out for each other.
To not look the other way.
It's on us to stand up.
To step in.
To take responsibility.
It's on us, all of us,
to stop sexual assault.
Learn how and take the pledge at itsonus.org.
welcome back to the last 15 minutes of today's show. And we've been talking about UTI surprises, and just before break, we were beginning to talk about what you could take to support your immune system and increase your sex drive. And Sherry Torkos here was just explaining to me the difference between Tongkat Ali and maca, and I was asking her about the side effects of maca. Would you like to continue what we were left off on?
Yeah, for sure. So when it comes to side effects, maca is generally well tolerated. However, there have been some reports, and I believe it was animal research, showing that it can have some effects on hormone levels, particularly estrogen, and there were some concerns that it could cause growth of uterine fibroids or tumors in I think it was female rats that were exposed to high amounts. Now, whether this is going to happen in humans, that we can't say. It is generally considered well tolerated. It's been used for hundreds, if not thousands of years. But for anybody that has a history of cancer or has any other hormone-related issues, I would just be cautious and make sure you're being seen by a healthcare provider when taking maca. But yeah, maca has, it's been used for a lot of things, from helping with sexual health and helping to boost libido, to possibly also helping with other female-related issues such as polycystic ovarian syndrome and other things.
Yeah. Okay. Just now you talked about Tongkat Ali and how they've been well researched in Malaysia especially. So of course I'm from Singapore and I'm well familiar with that. So a lot of times they even put it into their coffee, and they so I really don't know like how much of it is good and like how pure it is. So how do we go about getting something like Tongkat Ali? Like you mentioned a brand just now. So where might we go and get that?
Yeah, so it's important, I think, to look at brands that are studied for science and, their levels of active substances. From what I've read, a particular extract called Physta, Physta, that particular extract of Tongkat Ali has been studied, and I believe the dosage used is typically 50 to 100 milligrams daily.
Okay. And where might we get that?
Yeah, so I think you can get Physta. Let me just see here. I've seen it in a box of supplements. If you just go to Physta and Google search that, you'll see some products that come up with the Physta research. The company, the parent company, is Biotropics, and you can also go to biotropics.ingredients.com to read more about that particular brand. And there may be other brands that have been researched as well, but this is just one that comes to mind that I'm familiar with.
Great. Thank you so much. I really appreciate your expertise and your advice. So where can we go and get more information of what you've talked about today?
You can check out my website. It's sherrytorkos.com. It's SherryTorkos, sherrytorkos.com. You can check out my website, my blog. You can read my articles and check out my books as well.
Yes. You have written so many books. Are you working on another one?
No, not right now. I have a 6-year-old boy now, so that keeps me busy, and I don't foresee any books in my near future. It's a huge time commitment. I did enjoy writing, but from a time perspective, it's very demanding. So with my son, he's now 6, probably not get back to book writing for a little bit.
So what are you working on? Any exciting projects?
Right now, I'm working on some media campaigns to raise awareness about, we're getting into allergy season, so talking about allergies and spring break travel health tips. So I'm talking a little bit about ways that people can stay healthy while they're traveling, managing motion sickness, digestive distress, and things like that. So that's what's keeping me busy right now. That, and then of course taking care of my active 6-year-old with all of his activities, piano and swimming and dance and hockey. That keeps me pretty busy.
Yeah, I imagine. Okay, so on this show, I always ask my guests what they see is the link between our sexuality and spirituality. I'd like to ask you this question. So just maybe if you can just say a few words in your own personal opinion, the link between the two.
Oh, wow, I never even, so a link between sexuality and spirituality. Well, I consider myself more of a spiritual person than a religious person per se. And from a sexual perspective, gosh, other than loving yourself and being comfortable with yourself, accepting yourself is, I think, going to give you a greater feeling of balance and peace. I think all too often today, women in particular feel shame about their bodies, whether they're too fat, too thin, they've got cellulite, they, are typically very hard on themselves. And so I think trying to get to a place where you are accepting and feeling love for yourself is going to help you in all aspects of your life.
So where do you see being comfortable with our sexuality being something that is spiritual? Do you see a link between the two?
No, I think so. If you're not comfortable with your body, that can hold you back in your relationships and in many aspects of your life. And, I'd like to see, women in general get to a place where they are feeling more, more again at peace with themselves. And I think that will translate into many areas of their lives.
Yeah, that's really important. But what advice do you have for people out there to get in touch with their sexuality? Things that have worked for you, perhaps.
So to get in touch with your sexuality, well, I guess, speaking to a sex therapist perhaps is a good idea as well. Reading, reading and, there's, I think lots of different areas people can explore. There's, support groups and, a lot of different options today. And thankfully we do have more open discussions today. It's not a taboo subject like it was, say, 20, 30 years ago. I know my mother's generation, you didn't talk about sex, you didn't talk about your body, and women did feel, very uncomfortable in those areas. And thankfully now I can tell you, working as a pharmacist, I talk about everything. I have patients that come in and talk to me about problems with low libido or vaginal dryness or erectile dysfunction. We talk about it all, and thankfully today there are things that people can do and take to help them in supporting those areas of their lives.
Yes, indeed. Okay, so any last things that you want to talk to our listeners about?
Yeah, well, I could mention out my website again for more information. It's sherrytorkos.com. It's SherryTorkos, sherrytorkos.com. Check that out. Also, check out my most recent book, which is the Canadian Encyclopedia of Natural Medicine. You can pick up a copy on Amazon. So if you go to Amazon.com, type in my last name, Torkos, Torkos, and you can pick up a copy very reasonably priced at Amazon. And it's an A to Z reference guide on conditions, everything you wanted to know about, everything from acne and allergies to diabetes and heart disease and low libido, menopause, prostate disease. Even I get into, vaginal infections. There's a lot of information. I talk about both the conventional and the natural side of things.
That's great. I'm on your blog right now, and it's a lot of articles. I guess I'm seeing that you publish at least once a month.
Yeah, I try to. It's, here and there as I have time, I try to get information out there and share what I'm doing.
That's really awesome. And also you have a Facebook page, and that's holistic.sherry.
That's right. At holistic.sherry.
That's really
That's
great.
my Facebook page. Yeah.
Great. So thank you so much for coming on to today's show. I really appreciate your time. And just to remind listeners that Sherry Torkos, she uses her expertise in pharmacy and nutrition to educate people on complementary therapies to optimize health and prevent disease. So thank you very much, Sherry.
Thanks for having me.
You.
Have a great day.
Thank you. So next week we're gonna have me in Penang, and I'm going to go live from Penang talking about my new campaign. I'm going to start a free Facebook campaign, and people can just join this campaign. And it's going to be a closed Facebook group, and I'm going to post videos and interviews and freebies and resources around how you can start doing emotional release to release negative emotions that are in your body, in your system. We have repressed anger, frustration, sadness, shock, overwhelm, and all these negative emotions that we are holding on to that is locked into our bodies is not serving us. And if you want to be a sexual, healthy person, it's very important that before you even talk about getting more into your life, to let go. How do we let go of negative emotions that doesn't serve us? So in this campaign that I'm planning to do, called Clean and Clear, it's going to be sharing all these resources, and from there you'll be able to participate and find out how other people are doing, and also share your own thoughts and experiences with trying these different techniques. So it's completely free, and I want to do it because I want to help as many people as I can. I'm beginning to see a big link between that and freeing up your body so that you can feel more and have more pleasure. So if you're interested to be one of the first people to join this campaign, go to Facebook, type in Clean and Clear, and this closed group is still a work in progress and going to have more resources from there. So in the meantime, stay beautiful, keep masturbating, and have great sex, because life is amazing and wonderful, and we love sex here. So stay tuned and see you next week. Goodbye.